Okay, so for this video, we are going to be going over palpations of the head and the face. We're going to skip palpations of the neck because we'll get that when we do the cervical chapter. So we're going to use Jenna for my palpations today. This will be part of your practical exam. I'll be calling out different bony landmarks and you will have to palpate them. So as a review, we're going to sort of go over the different structures and then I'll give a good palpation. So we'll have Jenna sit up straight, okay, and look straight ahead. So the cranium, the front part of the cranium right here is called the frontal bone, okay, and it covers the superior part of the orbit of the eye and all the way until we get to the parietal bone back here and the temporal bone right here. And so when we're palpating the frontal bone, because this is a flat bone, we're feeling for any divots or any areas that could possibly be pushed in. If you feel a pushed in area or a divot, you want to stop palpating that area because that could indicate that you're pushing on brain tissue. As we move posteriorly, go ahead and bring the camera back here, Benj. Remember, the parietal bones are going to be from the frontal bone all the way around the skull here, and it's divided in two by the sagittal sutures. And so again, when we're palpating through this area here, we're feeling for any divots, we're feeling for any pushed in areas, any lumps, any swelling, anything of that nature. If we come to the back here, we remember that the base of the skull right here is called the occiput or occipital bone. And so down here, you can feel the soft part of the spine. And this is where the brain stem meets the spinal cord. And so we have to sort of protect this area really good right here. And if we're feeling the back, what we want to do is find that knowledge bump, that external occipital protuberance. And if you feel on the back of your head, it's a little bump right there that you can feel. And then you can feel a ridge that goes all the way across out here. This is called the supranuchal line. So you'll have one on each side that will go all the way to the temporal bone and the mastoid process, which we'll talk about. So you'll have to palpate that external occipital protuberance. You'll have to palpate that supranuchal line. And remember, I said anywhere there's a ridge or a bump or a risen area on a bone, it means that a ligament or a tendon, fascia or retinaculum is attaching to it. And so on the supranuchal line and on the external occipital protuberance, when we're palpating there, we're palpating for the splenius capitis muscle, which is an extensor to the neck. We're feeling the trapezius muscle as it attaches in there. And then the external occipital protuberance, we're feeling what's called the ligamentum nuchae, which is a ligament that attaches to all the way down the cervical spine. And so we'll just sort of palpate the area again for any tenderness. This is a great spot to massage out when someone's having some headaches and some neck pain in there as those traps attach to the back of the skull. If we work our way here, so Benj, just bring the camera to this side right here. If we work our way down the supranuchal line, we're going to be on the temporal bone. The temporal bone takes up the space all around the ear right here. We know our temples are right here, but there's three main parts that make up the temporal bone that stick out. And the first one is right behind this earlobe, and it's called the mastoid process. And you can feel it right here. It's that little bump that sticks out that you palpate through there. And your sternocleidomastoid muscle, that big neck muscle, attaches right there on the mastoid process. Just in front of the earlobe, we have what's called the styloid process, and we can't palpate that, but it's sort of a projection, like a big point that comes down and sticks in there. And then finally, the front part of this temporal bone is called the zygomatic arch, or zygoma. And I told you in class earlier today that we would take the index finger and the thumb and we would pinch on both sides of it and we could feel through there. And so we, again, Want to feel that temporal bone for any divots or sucked in areas, and any tenderness or pain for some of those things that might be attaching to it. The zygoma right here is where the temporal bone comes down and goes behind, and it actually attaches on part of the mandible, the coronoid process, which we'll talk about in just a little bit. So now if Benjamin comes to the front here, we're just going to go through some of the palpations of the face. So we already talked about the frontal bone right here and what to feel for. This is called the orbit of the eye, and it's made up of lots of those facial bones. So the top part of the orbit of the eye is made up of the frontal bone. The medial portion is made up of the nasal bone and the maxilla, the zygoma over here, and the temporal bone over here. And so there's a lot of different portions of bone through there. So when we're doing a palpation, we never touch or palpate the actual globe of the eye, the eyeball itself. You only want to palpate around, and you're feeling for any lumps, divots, or a step-off deformity, and that would be like stepping down from something. We're feeling for pain, we're looking for swelling, we're pushing in, any of those things we're looking for. When we get to the nasal bone, remember in class today, all of this right here is cartilage. None of this is actual bone. If you feel backwards, that's where your nasal bone starts. And so if you want to palpate that, you would palpate through there. Coming down here, we're now on the upper jaw, the maxilla, and that is where the top teeth go into, the nasal bone runs into, the bottom of the eye socket or the inferior orbit of the eye. And so we can feel that whole upper jaw there. We can look in their mouth and make them smile and see if the teeth look loose, if there's a fracture through the maxilla right here. In class, I talked about the Lefort fractures. There's 4 different types of Lefort fractures depending on how many fractures there are through the center part of the face. And so we would look for that. When we get to the mandible, remember the mandible is the only part of the face that is freely movable. It's got a nice synovial joint at the temporal mandibular joint, or TMJ over here, and it has all of these portions. So right here is going to be the base of the mandible, and we've got that mental foramen where that mental nerve comes through right here. Then we've got sort of this area right here called the body, and this is where a lot of fractures can occur. So we want to take this from the top and the bottom, and we want to push on it, and we want to feel for any shifting, moving, or pain. When we come to the edge, this is called the angle of the jaw, and you can really feel where that angle changes. And then we've got the flat surface right here until we reach that zygomatic arch in the zygoma bone. And this is where we can palpate and open up the mouth. So she opens her jaw, open up, go ah. Okay, we can feel right here is the coronoid process, which is the hook or the projection that comes out. When she closes her mouth, it goes back under the zygoma. So if she opens up, and the big masseter muscle that we're going to talk about on Wednesday this week is right here. So if she clenches back down and tightens her teeth up and grinds her teeth together hard, not side to side, just push down, we can feel this big masseter muscle here on the side, and it attaches onto that coronoid process. So finally right here we're going to get to the TMJ, and that's the temporal bone mandibular joint, and there's actually a meniscus in there. And I told you the other day that if she opens and closes her mouth, we can put our fingers right here and feel open and close, open and close. We can feel the conoid in there and see if it feels like it's shifting or dislocating. So that's an external palpation. If we want to do an internal palpation, we would normally put our gloves on, but I don't have a pair. So she's going to look forward, and I'm just going to stick my fingers in her ear and press forward, and then she's going to open and close her mouth again. Keep doing it. And you can feel the other side of that joint. And so if someone's been punched in the face or hit by blunt trauma playing a sport, sometimes we can have a sprain through either of these TMJ joints. And of course, we know that some people have chronic TMJ problems that cause headaches. They have to wear mouth guards at night, and they have popping and looseness in the ear, in the jaw. And so that's what we're looking for and doing as we're going through palpations. You're feeling for any changes in temperature, you're feeling for any movement, crepitus, you're looking for pain in the person, and you're feeling for step-off, divots, and deformities. So as we go through, we're just going to be assessing all of these parts. And so when I do a practical exam with you, I will just call out each of these bony landmarks, and instead of just saying here or here, you're actually going to have to find the nasal bone, and you're going to have to palpate it and really feel around and show me that you know where each part of the bone is and that you can assess it properly. Thanks, Ben.